Good day everyone, I'm Rhea L Villahermosa from VSED Science 3. So in this video, I will be discussing my assigned topic about the applications of modern physics in medicine. So modern physics plays a very important role in the healthcare today. Kung sa una, doctors relied lang sa physical check-ups. Karon, because of the modern physics, we can already see inside the human body without any surgeries. So some of the medical technologies we will discuss are the magnetic resonance imaging or the MRI, positron emission tomography or the PET, and last is the radiation therapy. So these technologies are based on the electromagnetism, nuclear physics, and particle physics, which help in diagnosing and treating diseases more accurately. So first, let's start with the MRI. So what is the MRI? The magnetic resonance imaging, or the MRI, uses the nuclear magnetic resonance to produce detailed images of the soft tissues. Its key principle states that protons in the magnetic field absorb and emit the radio frequency energy. Based on the principle called the nuclear magnetic resonance, it uses strong magnetic fields and radio waves to create very detailed images, especially of soft tissues like the brain, muscles, and organs. So, unsay nahitabo sa MRI? When a patient is placed inside the MRI machine, the strong magnetic field aligns the protons in the body. Then, the radio waves are applied, and when these protons return to their original position, they release signals that are converted into the images. I have a picture here in the magnetic resonance imaging, or the MRI. Now, kining a picture explains how an MRI machine works using magnetism and physics. In simpler terms, it follows these three steps. First is a no magnetic field. Sa sugod, the protons, the tiny magnets sa imong body, are pointing in the random directions because they are scattered, meaning wala sila clear signal. The second step, this one in the middle, the strong magnetic field, meaning inigsulod nimo sa MRI, the machine applies a strong magnetic field. Ang mahitabo, the nuclear will align themselves with the magnet. Imbis nga magkatag, maglinya na sila tanan in one direction. Now, the last steps in the MRI is the RF pulse and the signal. So in this one, the machine then sends a radio frequency or the RF pulse. The disturbance, kaning nga pulse, mo disturbs the protons, causing them to tilt. Second is the relaxation. When the pulse stops, the protons returns to the origin position. Last is the signal emission. While nimbalik sila sa ilang original position, they release the energy or a signal. So mauni ang kuhaon sa computer para mahimong detailed image of your brain or the body.
Now, for the basic solution problem for the MRI, I have provided here the problem. An MRI machine uses a magnetic field strength of the 1.5 Tesla, given the your magnetic ratio of hydrogen node is 42.58 megahertz per transfer. Determine the resonance frequency used by the MRI scanner. So the given here is the Y or the gamma is equal to 42.58 megahertz per transfer, while the B, the magnetic field strength, is equal to 1.5 transfer. Now, how to solve this? The formula for the MRI is the F is equal to the gamma times the magnetic field strength, which is the V. So, first we have to substitute the given values in the formula. We have the F is equal to the 42.58 times 1.5, multiply the values, and we have this answer. The F is equal to 63.87 megahertz. So the final answer is the MRI resonance frequency is 63.87 megahertz. So this means, the frequency of the radio waves is 63.87 megahertz, meaning is that the precise frequency is needed to produce clear images. Kung sayo pang frequency, dili klaro ang image, which can affect the diagnosis.
So another application used by modern physics is the positron emission tomography, or PET. PET is the nuclear medicine imaging technique that detects gamma rays emitted directly by a positron emitting radionuclide tracer, or that is introduced into the body. So PET uses the radioactive tracers that are injected into the patient's body. These tracers emit positrons, and when a positron meets an electron, they annihilate each other or they destroy each other. Its key principle states that when a positron emitted by the tracer meets an electron, they annihilate it just like what I said earlier, producing two gamma rays photons traveling in opposite direction. These protons are detected to reconstruct an image, means this process produces energy, and this energy is detected by the PET scanner to show how organs are functioning, not just how they look. That means, so dili lang ni pang structure but also pang function good, like metabolism sa brain or sa cancer activity. Now, the last application that it uses stimulator physics is what we call the radiation therapy. So the radiation therapy is a medical treatment that uses the high energy radiation such as the X-rays, the gamma rays, or the particle beams to destroy or damage a cancer. We also have here the applications for the radiation therapy. Radiation therapy uses the ionizing radiation to destroy cancer cells. It works by damaging the DNA of tumor cells, preventing them from growing, dividing. Ang goal ani is to target the cancer cells only, while the minimizing damage to healthy tissues. Now, I also prepare here a problem example for the radiation therapy. So during the radiation therapy, 2 joules of energy are absorbed by a 1 kilogram of tissue. So determine the radiation dose delivered to the tissue. Let's have this as given. So the energy, we had the 2 joules based on the problem above, divided by the mass is equal to the 1 kilogram. So solutions, step by steps. The formula for the radiation therapy is the dose is equal to the energy over mass. So solutions, of course, let's have the substitute the values into the formula. We have the dose is equal to 2 joules divided by 1 kilogram. Compute the result. Dose is equal to 2 G, Y, or gray. So the final answer, the absorbed radiation dose is 2 gray. So this means the patient received 2 gray of radiation dose. Importante kaayo ang correct dose kay kung kulang is equal to dili effective. Sobra, delikado sa healthy cells. That's why medical physicists carefully calculate the radiation dose. So in conclusion from my presentation for the application for the modern physics in medicine, to summarize it all, the MRI provides the detailed images using the magnetic resonance. Then the PET detects the metabolic activity using the radioactive decay, while the radiation therapy treats the cancer using controlled radiations. So all of these technologies show how modern physics greatly advances medical science and help saves lives. So without modern physics, dili ingani ka-advance ang medicine karon. So thank you, and that includes my presentation.